John Hook's Newsmaker Saturday starts now.
Thanks for joining us on Newsmaker Saturday. We got a bit of a bombshell this week when we found out that the person who had become largely the face of the coronavirus fight here in Arizona was leaving her post, and will leave her post at the end of August. Dr. Cara Christ has been on that position, appointed by Governor Ducey back in 2015, and I believe is the longest serving director of the health department in history. Dr. Cara Christ is our guest on Newsmaker Sunday. Great to see you. Congratulations on your new position with Blue Cross Blue Shield.
Oh, well, thank you. It's great to see you too.
It's good to see you. Okay, let's get this out of the way up front. There's been a lot of stuff written that you must be leaving because you're at loggerheads with Governor Ducey over CDC guidelines that you are putting forth, which you have to do as a state health department, right?
Yes, there's a lot of speculation. I can guarantee it had absolutely nothing to do with any disagreement. In fact, we are in perfect alignment with the governor's office. He has always said that he's going to follow CDC guidance, and that's what we're doing by adopting their recommendations for masks in schools and in public settings.
So your decision to leave had been in the works for weeks, months?
So it had been in the works for quite a while, several weeks at least. It's an incredible opportunity with an organization that is community health focused. They're focused on the health and wellness of their members. And it just was a great opportunity that couldn't be passed up.
What about the timing, Dr. Christ? Is it a good time right now? I mean, you must have thought maybe a month ago or so, well, we kind of got through this, and then we get the Delta variant, which now complicates things, and you still have a month on the job, and it could get very complicated here for the next month.
Yes, I think with public health, there's always something important going on. So I don't know that there's ever a time I would have felt would have been a good time to leave. I think with this, our main goal was to get vaccinations out and make them readily accessible. And in Arizona, I think we've done a great job with that. We had the mass vaccination centers that we were running. Those have all been phased out and shut down. We've got vaccine in pharmacies and doctors' offices and all around the state. So I feel good about where we are from a prevention standpoint.
How do you feel about what President Biden unveiled on Thursday, that to incentivize people to get this vaccine, because the Delta variant largely is among the unvaccinated overwhelmingly, to offer Americans $100 to go get the shot?
I think incentives are great in encouraging people to go get vaccinated. It is a tool that we have now that we didn't have during previous, large numbers of cases. So we would encourage everyone to go get fully vaccinated, especially with the Delta variant out there.
Dr. Christ, give us a sense of where we are right now with the pandemic. The Delta variant threw us a curve. How concerned are you that as viruses do, they mutate? And we're getting one here that's a little tricky. Should the vaccinated be worried about being infected by the Delta variant?
So, like you said, this has been a tricky virus, and the Delta variant has certainly thrown a curve. What we would tell those that are fully vaccinated is you don't have to be worried about significant outcomes such as being hospitalized or dying from COVID-19, because the vaccines are highly effective in preventing death and hospitalization. However, what you might be worried about is that you may still get an asymptomatic or very mild case of it, and you could pass it to others. So we would encourage people just to make sure that you're washing your hands, you're staying home when you're sick, you make sure you're fully vaccinated. And if you're going to be out in public with people you don't live with, it might be a good idea to wear a mask.
This is the one that everybody's freaking out about, the mask wearing. People who've gotten the vaccine, I've had COVID and gotten the vaccine, Johnson & Johnson on top of having had it in February. So I'm sitting here thinking, why do I need to put a mask on if I'm protected? But what you're telling me is I may still get this. It's possible. What are the percentages?
So we don't have a great idea about percentages, but we do know that breakthrough cases are rare and that those that are getting it are mostly mild or asymptomatic. I would kind of look at a vaccine like a life vest or a seatbelt. when you get into the car, you put the seatbelt on. It's not going to prevent you from getting into a car accident. But if you were in a car accident on the way to wherever you're going, it's going to protect you likely from serious injury or death. And that's what the vaccines do as well.
Okay, so then the mask on top of it for the vaccinated, is it helpful?
So having the mask, what they've shown is that the data of these breakthrough cases is showing that there's the chance that vaccinated people still can contract the virus. They can still have viral loads that can be transmitted to others. And so based on that data is why they're recommending that you should wear a mask when you are around people that you don't know their vaccination status, because we don't want you to get it, but we also don't want then you to be able to transmit it to others.
Is it fair to say, though, that this is a pandemic now among the unvaccinated?
Yes. So the data is showing that this is really becoming a pandemic of the unvaccinated. 98% of the deaths are in those that are unvaccinated. And this month, 90% of the cases are in unvaccinated individuals. So we really are seeing the burden, and especially of hospitalizations and deaths, in our unvaccinated population. I'm
trying to look for the data, but I believe in Arizona we're at 45% vaccinated. The nation is at about 49%. Am I close?
Yeah, so that's the fully vaccinated.
Fully vaccinated. Both shots, if it's Moderna and Pfizer, or one if it's Johnson & Johnson. So the question is, if that's the case, do you suspect that the other 50% who are not vaccinated, that many of those might be people who had COVID and they feel that they're inoculated naturally and they're not going to get the shot on top of it?
That is one of the reasons that we're hearing people don't feel they need to get a shot, is because they've had COVID in the past. What we would recommend is, we don't know how long that natural immunity lasts. We would encourage you to get vaccinated. It's going to provide you with even extra protection, and it's going to be long lasting, and we know that it sticks around.
Okay, so with the vaccine, what you're telling me is your chances, if the Delta variant came into your orbit and you contracted it, if it was a breakthrough and you're vaccinated, you will not probably be hospitalized or die from it.
Yes. So if you are fully vaccinated and you come into contact with a Delta variant, which is going to happen more often because we're having more cases, there's more community spread, the chances that you will end up in the hospital or dying from that infection are very, very rare.
We're looking at the video right now of you vaccinating Governor Ducey, and you were out at a lot of these vaccine sites. You were kind of on the front lines doing this. It wasn't just a photo op. You seemed to enjoy it. Just a little bit about the governor, because you got criticized from both sides. People who didn't think you were doing enough to stop the spread, people who thought you were doing too much and killing business. When you look back at Arizona in total, I think it appears, if you're being honest about it, that we found kind of a happy medium here.
I would agree. When you look at the overall response and compare us to what other states did, we did find a happy medium. And we always like to say it provides us some solace when, we had people telling us we were doing too little. We had people telling us we were doing too much. So we must have been right in the middle.
What's funny about that? That's exactly how you gauge it as a journalist. If both sides are yelling and screaming at you, you've kind of found the middle ground.
Yes, it's a good gauge. And so, we've really tried to balance, keeping people safe, making sure we have hospital capacity while making sure that people can still work, they can get their health insurance, they can get money for food and rent, because all of that plays a huge role in an individual's overall health. Let's talk about kids. And I may be misquoting you, but I seem to think that you said for your kids who are ages, what are they again? I have a almost 7-year-old, a 10-year-old, and a 13-year-old.
Bless you. I know that feeling. We were in the zone defense for years and still are. You said that your kids, the ones who can't be vaccinated, under 12, you would ask them, you would want them to wear a mask at school. Is that correct?
Yes, that's correct. I actually, with the new the updated CDC guidance now, even my fully vaccinated 13-year-old is wearing a mask at school.
Do you worry about, I mean, a lot of parents are buckling, they're bristling at this. They don't like their kids being back in a mask, and they're really not happy about this idea. You have to appreciate as a parent, right, the socialization part of it, just being able to carry on with your life, because I think we all felt if we got vaccinated, you know, the end of the mask, but the mask is coming back.
Yeah, I think that was a huge blow to everyone's morale. Like, we had this light at the end of the tunnel. People were getting vaccinated. You could return to a normal life. That was a huge incentive for getting vaccinated. And now we have the Delta variant. I know my kids were disappointed when I told them that they would be wearing masks when they went back to school. I think luckily for me, a lot of the parents of my kids' social circles also sent their kids back in masks, but it is difficult because the kids don't want to wear them. I do tell mine that when they're outside and they're playing, they can take them off at recess and those types of things. And they've been doing it. They went back to school last Wednesday, and they're actually proud that they're doing it now. Okay,
so the critics would say kids are a lot more vulnerable to the flu or respiratory viruses, RSV, whatever it might be, that they're more in danger of being really sick from that than COVID. I'm talking about kids under 12. So why are we masking them when we don't for the flu or for RSV?
So for the same reason we're asking our vaccinated individuals to wear a mask. They're not really at risk of those severe outcomes, but what we do know is that kids can get COVID-19 and they can transmit it to others in their life. So if you have a group of kids of none of whom can be vaccinated under the age of 12, you know, you've got them indoors for long periods of time together. If COVID-19 is brought into that environment, it could spread, and then those kids could take it home and potentially pass it on to vulnerable family members that, you know, may be at high risk for hospitalization and death. So it's really to slow the spread and to prevent further transmission.
Okay, let's just reflect a little bit on the past couple of years. You've been doing this since 2015. Governor Ducey appointed you. What was the high point? What was the low point?
There's been so many high points. I would say the most recent high point was probably opening up the vaccination center out at State Farm Stadium. That was like the light at the end of the tunnel, and it was just it was a great experience. You know, you were out there directly saving lives by vaccinating people. I and my team was out there, and we had a lot of volunteers. It was just, that's probably the high point of my entire career, I would say.
And that got national acclaim, that center. I mean, the president talked about it. It seemed to be the model for everybody on how to do this.
The team did a phenomenal job putting that together, and we couldn't have done it without DEMA and the Arizona Cardinals and Blue Cross Blue Shield of Arizona. I mean, the way the community came together was just outstanding for that.
What was the low point? And I know you did talk before about how kind of you get into public health and you don't expect to become the political football being kicked around. You don't really expect that.
You know, probably the low point was, I would say last summer. Last summer was difficult. There wasn't a light at the end of the tunnel like there was in the middle of the winter surge. And it just didn't seem like there was a lot we could do to protect people. And so those were some long nights, and my team and I were just up worrying, how do we save lives? And there wasn't great answers.
Yeah, and not decimate the economy, because there are health consequences to that as well, and we're seeing them now. What is the lesson learned from this COVID experience? Can you draw some things where you look back and go, okay, we've learned this, this, and this?
I would say my two biggest lessons from this is one, that it is really good to have a flexible team. And I am so lucky with my team here at the department, because it didn't matter how we had to pivot. We just did it and, continued on, and we were always learning new things. And and making changes. I would say the other lesson is that I need to model the work life and home life balance a little bit better. You know, everyone always says this is a marathon, not a sprint. And I sprint. We've been sprinting since last January, and my team has been sprinting with me. And I just, you know, taking that step back, because the biggest lesson is how important your friends and family are during, I learned that during the pandemic. And so really taking that time to spend with them, knowing that time is precious.
Dr. Christ, do you think the health director should be appointed by the governor, or would there be some wisdom in having a healthy separation between the political and the health component?
You know, I do believe that they should be appointed by the governor. We are part of the executive branch. We have to implement and execute the laws. We get lots of different types of legislation that impact the department every session. And I think that it's good to have that connection to the governor when you're making these decisions. And so I would say that it should still be appointed by the governor.
Finally, the governor has, he got the law changed and well, he made the executive decision that there's going to be no mask mandate, no forced vaccinations. Have you tried to talk him out of those things?
No, I have not tried to talk him out of those things. I think we've learned a lot as we've gone through the pandemic. We've learned that mandates don't necessarily work. They're not always enforced. And those that were going to wear a mask or go get vaccinated, were going to do that regardless of a mandate. And those that weren't, even in the face of a mandate, weren't going to do it. And there wasn't a lot of enforcement. I think that, really trying to encourage and educate people about why it's important, and then having community leaders model that behavior, I think that works better than the mandates.
Dr. Cara Christ, good luck. I hope we'll be talking to you in the future. I mean, you're with a big company, Blue Cross Blue Shield, coming up in a month, and let's keep the lines of communication, and we'll have you back.
Thank you.
Okay, good luck. Best of luck. Dr. Cara Christ. We're back in a moment on Newsmaker Saturday. Welcome back on Newsmaker Saturday. This is going to be fun because maybe you're at home right now and you need to return to the office. And maybe you've been working at home for a year and a half and you don't want to return to the office. Maybe you're a manager and you want your people back in the office, but you're getting resistance. We're going to talk about all this and what we've learned about the workspace in the midst of a pandemic. Rebecca Ryan is an economist and author. She joins us from Madison, Wisconsin. Thank you, Rebecca. We appreciate it.
Thanks for having me, John.
You're illustrating one of the changes in this program. We're bringing in people from all around the country now. We didn't do that before. People would sit here in the studio. Zoom has opened up a whole new world for this program. We've seen changes. What's happening in the workforce? What have you seen?
Well, let me start by asking you a question in return. Are you going to put this genie back in the bottle? Now that you've discovered that you can have a wider roster of subject matter experts and guests, are you going to go back?
I don't think
to the way it was?
I think this is a new way of doing this.
Right. So for any employer out there who is saying, oh my goodness, I've got more access to better talent when I don't require people to live, for example, in the Phoenix zip code, and they can live anywhere, I actually have access to a global talent pool. This is a genie that we are not going to put back in the bottle because we've had widespread, from management level to frontline employees who can work at home, widespread adoption, and folks have realized this can work.
Yeah, I think there is a new model happening. And it's the result of a black swan that nobody saw coming, or few did, a pandemic that would force people to work from home. We kept a hybrid here at Fox 10. We had some people in the studio, very limited, a lot of people working remotely. A lot of businesses have done this, and some of them sent everybody home.
Yes, and I think what you guys have experienced there is something, this hybrid model, this is going to be the de facto way that most organizations work moving forward. And the truth is if you think about 2019 and before, there were a leading edge of companies, the ones who were the early adopters, the ones who had tried this model before, who are now looking at the rest of us and saying, yeah, we were in the future a little bit before you were. But now what we've done is we've moved the majority of us kind of through the curve, right? Like the majority of us have now had this experience. We've realized that not only can we be productive, sometimes we can be more productive, and we don't want to go back. I think one of the interesting things that's happening right now, and as a futurist, one of the things I'm wondering about in the future is how long the center of power will be with employees versus employers. Because in the past, if employers said, I want you in the office, employees said, we'll be right there. But now we're experiencing with Google, with Apple, those organizations who are saying, everybody come back, and employees saying, not so fast. And we'll see where the power lies.
There's a quote I read in an article that took on this entire topic. It said, remote work empowers those who produce and disempowers those who have succeeded by being excellent diplomats in the workplace and poor workers. It removes the ability to seem productive when you're really not, and also, crucially, may reveal how many bosses and managers simply don't contribute to the company's bottom line.
The thing I go to right away when I hear that quote, John, is extroverts are advantaged in an office environment.
Wow.
And introverts who are not dumb, who are not poor producers, they've said this has been our moment to shine, right? I haven't had the disruptions. We're all on a level playing field. I can focus and do my work. And so I think what this has done is it has revealed some of the biases we've had that favor some in an in-person environment and disfavor others.
That's really interesting. Now, obviously, there are jobs that you cannot do remotely. I mean, in the service industry, you've got to be there. But for the tens of millions who spent most of their days sitting at a computer, you can frankly do that anywhere, right?
You absolutely can. And, I don't want to paint this with an all or nothing, right? What we know is that being together does benefit all employees, introverts, extroverts, bosses, those who are bossed. It benefits in many ways. But what we don't know is all of the ways that happens. So when people paint with this broad brush and say, well, everybody has to come into the office, I say, why? I think the future workforce is going to gravitate towards employers who are willing to meet employees where they can do their best work. Sometimes it's at home, sometimes it's not at home. But that's the future of the workforce, are employers who are going to be able to work with their employees to craft solutions that are going to work well for both parties.
Yeah, this was the question, is what is lost working remotely that's profound that you've discovered?
Yeah, I think there are certain moments in an employee's life cycle or in the moments of an organization where being together really matters. Like, one thing for sure is every young person who's never had a job before, who's coming out of college, they benefit by being surrounded by their coworkers in physical proximity.
Yeah.
Because the truth is, we tend to give promotions to people that we have a lot of contact with. So for new employees, they need to be around their coworkers. They need to be very intentional about building those relationships so that they can get promoted and get recognized. So that's one thing. The other reason that being together really matters is when you have to have those kind of informal conversations, those informal communications. The idea when you just want to pop your head into somebody's office and say, can I just talk to you for a minute?
Yeah.
Those are times when the physical workplace, it just reduces the friction for that. It is just harder for you and I to text each other, or for you and I to jump on a Zoom when one of us is having one of those spontaneous
Sure, and you
moments.
can't read the nonverbal cues. It's very difficult. This is a fascinating topic. Rebecca Ryan, economist, author, thank you for your time. Can we have you back?
I would love to be back with you, John.
Okay.
Thanks for exploring this topic.
You've got it. Thank you. Rebecca Ryan on why workers are considering even calling it quits if they have to come back to the office. We're back in a minute on Newsmaker Saturday. If you want to pass on this show to someone else, here's where you do it. Fox10phoenix.com/newsmaker, or prior shows. Thanks for joining us this week on Newsmaker Saturday. We'll see you again next time. We appreciate your time.